Late singer Sidhu Moosewala's mother, Charan Kaur, who's 58 years old, is expecting a child. वही reports की माने तो Charan Kaur underwent an IVF treatment to conceive the baby who's due in March. जहाँ हम ये बिल्कुल भी डिनाई नहीं कर सकते that conceiving after the age of 50 is quite impossible, especially through natural pregnancy. And even if you're getting pregnant through IVF, there are complications that can come in. So in order to get a clear picture on how difficult it is to conceive at an older age, menopause के बाद कौन-कौन सी complications आ सकती है, and also हमें कौन-कौन से precautions अपने mind में रखने चाहिए, and lastly, which is the right age to get pregnant, we will be speaking to Dr. Neema Sharma, who's a leading gynaecologist and laparoscopic surgeon in Delhi. Let's find out her day. Sidhu Moosewala's mother expecting a child at the age of 58. How safe is that?
Okay, so first thing is regarding this lady who has conceived. I think she's about 56, 58 years of age. Definitely she's postmenopausal. The average age of menopause is about 50, so she would have been postmenopausal for 8 years. Now at this age, if she has conceived, there are only two ways in which she can conceive. There's only one way actually, and that is through IVF. But in IVF also there are two ways. Either she has got her eggs preserved earlier, which she has it and she can use it for an IVF, or she has used donor eggs for IVF. Normally, at the age of 58, your eggs are not there. The quantity is not there. So obviously it has to be donor egg through which patient can conceive and IVF is possible. Now your second question is it safe? Now the medicine has advanced a lot. You can conceive even at this age. But it has to be monitored. Obviously, it is a high-risk pregnancy. It's called advanced maternal age. So it is associated with high-risk pregnancies starting right from the first trimester, second trimester, third trimester, during delivery. All the high-risk factors are there. But yes, it is possible. And these pregnancies can have good outcome. And mother and baby can be absolutely fine after delivery.
She is conceived using IVF. A little detail about the process.
IVF is called in vitro fertilization. It is done in people who have difficulty in conceiving on their own. There can be various reasons for it. If there is a problem in the eggs, if there is a problem in the sperms, or if the tubes are blocked, or it could be unexplained also. So in those cases, the IVF people, who do IVF, they take out the eggs. Basically, first they give injections to stimulate the ovaries to produce good number of eggs. Now these eggs are then retrieved, are taken out from that woman under general anesthesia. They are kept in the lab. Then the semen is taken, the sperms are taken, they are kept in the lab. In the lab, they'll make a baby, an embryo, and this embryo or a baby can be kept in the lab for quite some time till she is ready to have a baby. So that's called in vitro fertilization, means baby is being fertilized in the lab.
How safe is conceiving after menopause? What is the success rate?
So see, if you talk about IVF success rate, even in the reproductive age group, it's only 30-35%. And in the postmenopausal age group, since they'll be using donor eggs, the success rate is there. And regarding percentages, it's difficult to say the percentages, but the overall success rate of IVF is only 30-35% because there are no hormones. So a lot of hormones will be given for conception also and throughout pregnancy also, so as to maintain the pregnancy.
Older moms can face complications like diabetes, hypertension, and excessive bleeding too. What about that?
Any woman in advanced maternal age, if she conceives, the complications can start from the first trimester itself. So the first trimester means first 3 months. There's increased risk of miscarriages, increased risk of bleeding. Then most important thing is to rule out any chromosomal abnormalities in the baby. The problem is as the age advances, the number of eggs also fall. But in addition to that, the quality of the egg falls. So when the quality of the egg falls, it increases the risk of chromosomal abnormalities like Down syndrome in the baby. If you talk about the ratio, if a woman at the age of 30 the risk of chromosomal abnormality is about 1 in 1,000. But if a woman conceives at the age of 35, the risk of chromosomal abnormalities is about 1 in 353. And at the age of 40, the risk is about 1 in 85. So the risk of chromosomal abnormalities will be high in patients who conceive late. But nowadays, medicines have, we have advanced a lot and we can pick up all these chromosomal abnormalities even in the first trimester. Then as the pregnancy progresses, there's increased risk of diabetes, increased risk of high blood pressure, there is increased risk of bleeding, there can be low-lying placenta. So all these complications during pregnancy are more in advanced maternal age. During delivery also, there's increased risk of cesarean sections. And if they are going for vaginal delivery, there's increased risk of, non-progressive labor or labor dystocia, or after delivery, the shoulders get stuck, shoulder dystocia. Basically, all these factors are high-risk factor, which are more common in elderly women.
When a woman gets pregnant at an older stage of her life, her chances of giving birth to twins rises. Is it true?
Yes, it is. With advanced maternal age, the risk of multiple pregnancies are more. Okay. First thing is in IVF itself, it increases the risk of multiple pregnancy. So if a woman is going for IVF and planning a baby, it increases the risk of multiple pregnancies. So that's true that it increases the risk of multiple pregnancies.
Any preventive and precautionary steps to follow?
So first thing is, if any woman is planning pregnancy late, go for a pre-pregnancy counseling. That's called preconceptional counseling. See your doctor that yes, you're fit for planning pregnancy. If a woman is a known case of diabetes or hypertension, all these things should be under control before planning pregnancy. If a woman is overweight or obese, weight should be reduced. Good healthy diet, smoking, alcohol, tobacco, everything should be stopped. Folic acid and vitamin should be started at least 3 months before planning pregnancy. So these are few things which should be done before a woman plans pregnancy.
So that was all for today's informative segment. अगर आपको हमारा आज का वीडियो पसंद आया, then do not forget to like, share and subscribe to our channel. Have a wonderful day ahead.